Welcome back once again. This is Bread and Butter Primary Care. I'm Dr. Stokes, and today's video is cholesterol measurement when the numbers are too high. And so we're going to talk a little bit more about how we check cholesterol, what the number ranges are, and what is too high of cholesterol, when should we start being concerned about it. There'll be some other videos more specific about lifestyle things that can bring cholesterol down, medications that can help with cholesterol, so stay tuned for those as well. So we've already talked some, if you've seen the previous videos, about what cholesterol is, why we care. We've talked about bad and good cholesterol. Just a quick review: when you check someone's cholesterol, when you put in the order and you order a lipid panel, what you're going to get back is the total cholesterol, the high-density lipoproteins, the HDLs, or the good cholesterol, the LDLs, the bad cholesterol, something called the non-HDL, and then which includes some others that we don't talk as much about, and then the triglycerides. So that's a standard lipid panel. You're kind of going to get those four numbers, three of which are the ones that, at least in bread and butter primary care, we focus and look on the most: total, HDL, and LDL. Those are the three cholesterol numbers that we really focus on. Triglycerides, as I talked about in the triglyceride video, isn't technically cholesterol, but we kind of measure it and look at it as well. So this talk we're going to focus mostly on those three cholesterol numbers, how we measure them and what they mean, and when the numbers are just too high. So measurement is through a blood test. It's just a blood draw in which we can measure the amount of total cholesterol, HDLs, and triglycerides. The LDL count, this is kind of an interesting fact that sometimes people forget. The LDL measurement on a standard lipid panel isn't something that's actually measured, it's calculated. So the numbers you get from the lipid panel is going to be your total, your HDL, your non-HDL, and your triglycerides. And the LDL is actually calculated with those numbers. That's important because if the triglyceride count is too high, the calculation isn't accurate. And so sometimes you'll get a lipid panel, and you'll have a total cholesterol, you have an HDL, and then the LDL section will be like, unable to measure. There'll be some sort of error on that line, and then the triglycerides will be like 610 or 415. And what's happened is the triglycerides and non-HDL are high enough that the calculation can no longer be accurate, so they don't put in the LDL. This is the reason why lipid panels are best drawn if the patient has been fasting for 8 hours. Fasting, if you check the cholesterol on the patient's not fasting, it's not going to change much the total HDL counts, because those are directly measured, but it will change the triglyceride count. So someone who's eaten recently will have a higher triglyceride count than someone who's fasting. If that triglyceride count is high enough to throw off the calculation, then you're not going to get a good LDL, which is one of the most important numbers when deciding what to do with cholesterol. So you can get a non-fasting lipid panel, but there's always that risk that if the triglycerides come in high, you're going to lose your LDL, and then that's going to be a problem. So in most cases, get a fasting lipid panel. If you've got patients in your office and you need a lipid panel and their ability to come back isn't very good, they have to travel really far, if they have travel restrictions, in real life, bread and butter primary care, sometimes those things happen. It's better to get a non-fasting than to risk getting no lab at all. But if they can come back fasting and get that, then that's going to be your best way to go. And so that's what you get. So let's talk a little bit about numbers. So when is it too high? This is kind of an interesting question because the target has changed several times, even just in like the 7 or 8 years that I've been practicing. And currently, really, some people would answer the question, when is it too high? They would say, well, it's never too low, and the lower the better, which it can, seems to be for the most part true. So generally speaking, and before, like when I was in medical school, we actually just looked right at the raw numbers. So 200 for a total cholesterol was the number where we drew the line. Above 200 is high cholesterol, below 200 is within normal range. And then that was the total. HDL was 40, So if you, and actually HDL, remember, is the good cholesterol, so you want above 40. So under 40 is not good, above 40 was normal. And then the LDL in a person without any other risk factors, oftentimes they'll say 130, that we want it below that. Anyone who has any sort of other risk factors, below 100. And then nowadays people are even saying we want the LDL down below 70. So the LDL, the bad cholesterol, is one of those measurements where the lower the better. And so it's a little bit difficult to say, well, when is it too high? It kind of depends person on person, and really any lowering of the LDL is a good thing. Generally speaking, if it's just an otherwise healthy person, 100, it should be less than 130. But if they have any sort of other risk factors, you're going to want to shoot for under 100. Now, there's another video that I'll be recording in the future about cholesterol goals and when to initiate treatment. And you'll find that we don't, at least currently, we don't actually use the numbers to define treatment as much as the calculated risk factors. And so we'll talk a little bit more about that. So when we talk about cholesterol numbers, just keep in mind it's a good guide, a good general guide to see where someone is at, but it's not necessarily like, well, they're above 200, therefore they need treatment. It depends on a lot of other factors. So, but generally speaking, total, you want less than 200, LDL less than 130, but lower the better, HDL above 40. So those are the cholesterol measurements. You want to get that with a fasting lipid panel, if at all possible, and then those are kind of the general numbers that we look at. Take a look at the other videos for what happens when those cholesterol numbers are too high and why we care, and then future videos about when to initiate treatment, lifestyle things that have shown to be helpful, and other information like that. But for today, I just wanted to cover measurement and general number ranges, and so I hope that's helpful, at least in that sense, and stay tuned for more information. Have a great night. This is Dr. Stokes with Bread and Butter Primary Care.